Okay, good afternoon and welcome to the Governance and Audit Committee. The first item on the agenda is to elect a chair for the 25-26 municipal year. Could I have nominations, please?
Yeah, I'll nominate Paula O'Connor. You can second it. Sorry, could you hear me then?
Yes,
Sorry.
yes.
Oh,
second
sorry.
it, yeah.
I second it as well.
Any other nominations? Okay, all in favour? Okay, that's unanimous. Thank you very much.
Good afternoon, everyone, and thank you for nominating me again. And I hope I do it justice again for the forthcoming year. But thank you for your confidence. If we can move forward to the item 2, which is the election of the vice chair for 25-26. Can we have some nominations, please?
Yeah, again, I'll nominate Paxton Hood-Williams.
Are there any other nominations? No, are we all in favour? Okay.
Thank you very much.
Thank you, Paxton. Okay, into the main agenda items now. Apologies for absence, please.
Yeah, thank you, Chair. The only apologies we've had is from Ness Young and Simon Cockins.
Thank you very much. Agenda item 4 is any disclosures of interest, please.
Yes, Chair. Agenda item 11, Appendix A, I'm a member of the Port Authority. It's contained within the contents of the report.
Okay, thank you, Councillor.
And I'll fill the appropriate form and send it back to Jeremy.
Councillor Mike Lewis.
Yes, same as Mike White, a member of the Port Health Authority, and I will fill the forming to declare. Thank you.
Thank you. Any other declarations? No. Okay, if we can move on to the next agenda item, which is the minute of the meeting that took place on the 23rd of April. If we take them page by page, please, for accuracy. So that's page 1, page 2, page 3, page 4, page 5, page 6, and page 7. If I could have a show of hands if they're an accurate reflection of that meeting of that day, please. Thank you. Okay, Jeremy. And if we can move on to, we have 3 reports from Audit Wales at agenda items 6, 7 and 8. And I've been asked if we could take agenda item 8 first, which is the urgent emergency care flow out of hospital for the West Glamorgan region, so that it allows staff who participated in that work to be present for the meeting. So if I can hand over to Gareth.
Apologies, Chair. Our colleague has been slightly delayed. They will be with us by 1:10. I'm happy to take forward, if that would be appropriate, Chair, in the next 5 minutes, the work programme and timetable paper, which is agenda item 7.
Yeah, that's fine. That's fine.
Yeah.
If you could go to agenda item 7 then, please.
Thank you, Chair. So members will be familiar with the layout of this report. It gives an update as to where our work programme and timetable, not only for Audit Wales, but also for wider inspectorates, so Care Inspectorate Wales and Estyn was at the end of March 2025. I'm aware that this wasn't tabled at the 23rd of April meeting, but it is being tabled now. And there are a couple of really short updates, Chair, for members. as you'll be aware, the urgent and emergency care flow out of hospital report is the next item on the agenda, and my colleague Anne has just joined the meeting to be present for that. The commissioning report and the cybersecurity reports are currently in clearance with officers within the council, so we're hopeful that those will move forward through that process shortly, and then will be tabled for your consideration alongside the management response forms in due course. And we are currently drafting our report on the council's risk management arrangements, which obviously comes in the purview of this committee. And then just to take forward that our local government national studies, the capital planning report is in clearance at the moment, and so that will be coming through in July. The homelessness temporary accommodation report, that is coming through our external clearance process at the moment, and we're currently scoping our work on children's services, which I know is an important issue right the way across Wales, Chair. So I just wanted to provide members with that more up-to-date refresh of where we are on the progress of our work programme and our timetables, and more than happy to take any questions that members may have.
Thank you, Gareth. Any questions from members, please? Gareth, can I just ask, with regards to the risk management review, your drafting report, when is that likely to be heading its way to the Governance and Audit Committee? Have you got any idea?
I would imagine it will be early in the autumn, Chair, with the summer period. We're hoping to get that published in the next couple of weeks for clearance. By the time we've got that through and translated, and then we hit the summer period, it will be early autumn. I would imagine that we'll be able to present that back to the committee, Chair.
Okay, thank you for that. So if there are no further questions on agenda items, yeah, sorry, I have a hand up. Jeff, do you want to?
Yes, sorry, Chair. I know we've jumped a couple of agenda items. I hope it's not included in the other parts. You know, it mentioned the the positioning of Swansea and Neath and Albert quite lowly, really, with regards to discharges. Some of the well, first of all, I was going to ask really with regards to not why we are where we are, but why are the other parts of Wales where they are? You know, what are they actually doing? Is it only the shortcomings that have been identified, i.e., you know, I think the systems, the keeping of records, the training, you know, the discharges over the weekend and so on. So I'm assuming that other parts of the country are actually up there and we are down there.
Councillor Jones, can you hold that question? Because we've just dealt with agenda item 7, which is the work programme and timetable, and we're going to go back to the agenda item 6, which is that key document. Agenda item 8, sorry. Which is the key.
Sorry, I read the reply.
Yeah.
I know it's getting mixed up as such, so there we are. I'll hold it.
Sorry, Councillor Jones. You know, the question is very relevant, but if you can hold it, and then when the Audit Wales have presented that report, then we can follow those questions up. Thank you, Gareth.
No, that was it, Chair. I just wanted to make you aware that that was relevant to the agenda item 8.
Yeah. Okay. But there are no more questions on agenda item 7, which is the work programme and timetable. Then can we move forward? So do you want to do agenda item 6 now, or are you ready for agenda item 8?
I believe that my colleague Anne has joined the call. Anne is one of the senior team who've been responsible for this report across Wales, and so we're really pleased that she's able to join us today to give an overview of agenda item 8. And so I'll pass over to Anne.
Okay,
thanks, Gareth.
Welcome, Anne, and as I say, take it that we've read the report, but I'd like you to pick up any issues you'd like us to reflect on.
Thank you, Chair. So, as I said, I assume you've read the report, so just going to highlight a couple of things. So just to flag, this is a regional report looking at the cross-sector working between the Health Board and the local authorities. So it does obviously pick up Swansea Bay Health Board and Neath Talbot, as well as yourselves. to resolve discharge delays, their causes and the impact they're having on the urgent and emergency care system in the Swansea Bay region. The report's been cleared for factual accuracy through the RPB in collaboration with the Health Board and the local authorities. We've used the RPB mechanisms for all of the reports across Wales as that mechanism for that regional partnership working. It was an extensive audit which included cross-sector interviews, data collection analysis, and we hope it's provided you with a comprehensive overview of the current position, successes and challenges in the region. Overall, we found that while partners understand and show commitment to improving patient flow out of hospital, performance remains extremely challenging. Partners must continue to work collaboratively to mitigate the challenges posed by reduced workforce capacity and increased complexity of demand, continue to develop the shared systems to manage the information and to ensure activities and risks are joined up and monitored on a whole system basis. You'll see in the report we've made 7 recommendations, 4 of which are directed at the council but jointly with Neath Port Talbot and the Health Board, and these cover broad areas around 7-day access to services, training and guidance around the discharge process, embedding the role of the trusted assessor and having oversight of regional risks through the RPB. We've received the management response to recommendation, which you'll see in the report. That again, that's been coordinated through the Regional Partnership Board, and it's included obviously in the appendix of the report and Exhibit 27. It's really just for you now as a committee to be assured that those recommendations are going to be addressed appropriately and sufficiently by the management response. Other than that, I'm happy to take any questions on the report.
Okay, thank you, Anne. I mean, clearly this is a very important report for the organisation to receive, and certainly the process of the Regional Partnership Board has been critical in overseeing some of this area, and I'm assuming it's been included in your audit work as well. So if we can go back to Councillor Jeff Jones for your question, please, Jeff.
Yes, thanks, Chair. My apologies. As I said, because we skipped reports, I just read the whole lot of reports as one as such, you know. Yeah, my question, I don't know if you picked it up earlier with regards to, you know, some of the recommendations or some of the problems, shall we say, we've got. You know, it's quite, Swansea and Neath Port Talbot are ranked quite lowly with regards to the rest of Wales. I was really asking, with the rest of Wales, you know, why are they actually up there? Is it just the risk, just the problems you've actually identified in Neath Port Talbot, Swansea, and why are they actually achieving and we are not?
Anne, are you able to respond to that?
Question if that's okay, Chair? Yeah. So it's difficult to say in terms of the other regions because each of the regions are in different positions. So whilst, for example, if you look at your rate of delayed discharges, you are one of the highest. The Cardiff and Vale region, I think, is one of the lowest, and some of that is down to kind of priority settings. So, for example, the Health Board has focused predominantly on urgent and emergency care versus planned care. So that's more about a strategic kind of priority and focus. Some of it is around what capacity resources you've got, and again, that's kind of a strategic priority depending on you as organisations where you want to invest some of your kind of finite resources. So there'll be an element about capacity in the community. I think we've referenced in the report that Swansea Bay Health Board, for example, has got a lower access to step-down beds. So that's something, again, for the region. But a lot of the recommendations you've got in the report are actually featuring in most of the other regions, so they're not unique to you as a region. There are things around information systems, for example, and you'll be aware of things like the connected care and WICIS. Again, some of the challenges possibly with that, but that ability to share information across. I don't think we've found any region that's got discharge policies and guidance and training up to date and in place. So some of the themes are consistent across the regions, that you're not unique, but there are some nuances in individual regions that help them kind of move forward a little bit more. I'll use Cardiff and Vale again as an example. They've also invested quite heavily in a step-down facility, which has helped move patients out of hospital, get them back into the community. There's then challenges around some of the care capacity in the system, like domiciliary care, for example, around like social care workforces, etc. And again, they're kind of challenges across Wales, but all in different levels. And so some of that is about local initiatives that have been set up to kind of move some of those forward. So there isn't a single answer. to the other regions. They're all kind of nuanced to it. The one thing I would say is just on the back of these reports, we are going to be pulling together a high-level summary across Wales, which will tease out some of the areas, some of the challenges, as well as some of the kind of positive things that have been moving forward, if that's helpful.
Yeah, very helpful, actually. It's clarified the picture quite a lot. So there we are. Thank you for that.
I'm pleased to hear that, Anne, because we continually ask for what looks good and where can organisations learn from each other. So I'm pleased to hear those comments from you. Councillor Paxton Hood-Williams.
Thank you, Chairman. Interesting report, but what I was going to say was that during the pandemic, there seemed to be much closer cooperation between the health boards and councils. And I think many of us hoped that that increased level of cooperation would continue. It would appear that that level of cooperation, however, is sort of diminishing now and is almost going back to where it was pre-pandemic. I don't know whether you've picked anything up and whether you've got any comments to make in that respect.
Only that I'd agree with you, really. We've not really referenced that in the report because obviously we were looking at the arrangements across the partners to deal with the here and now in terms of flow out of hospital. But I completely agree in terms of that partnership and that. And I think it was more to do with the fact that it was a single focus on keeping the population safe during the pandemic. I think now it's kind of reverted individual organisations' challenges and the risk areas. So I agree with you, but it's not necessarily something we've kind of referenced in this report. But I do think there's something there about having that single kind of aim or objective across the partnership that would kind of help some of that.
Sorry, I'm just wondering what Welsh Government and Welsh Audit Office can do to re-encourage that cooperation, I think. Nice easy question for you.
It's probably not something for us to do. I think some of that comes from Welsh Government. We're not there to kind of set policy. What we can do is through some of our recommendations, so to look at things like strategic plans, etc., strategic objectives. One of the recommendations we've obviously made in your regional report is about having that oversight of regional risks, because that's something we've raised, that organisations look at risks in their own kind of organisational view, if you like, and not necessarily look at the wider risks for the population and therefore the roles each of the partners play in some of that. So that's one way of kind of doing that. But it's not really for us to kind of tell you how to do it. That's more about kind of Welsh Government directive, particularly through strategic planning, etc. We're cited, obviously, organisations have different requirements. Health boards have got IMTPs, etc. So it's that opportunity collectively for you to work together from a partnership perspective.
Okay, thank you.
Thank you. Councillor Mike White.
Yes, thank you, Chair. Yeah, just obviously touching on what the gentleman has said about obviously regional sort of working. But have all the hospitals got proper and updated key performance indicators that they can work to, and also the issue is as well about discharge is of the GPs being available on the weekend to give that obviously sign off on authorization, because sometimes people are there because the doctor that perhaps have seen the patient have got to write off the discharge forms, and they might not be available to a few days after the weekend. So is any tracking done on this?
So there's a couple of areas just in that. In terms of key performance measures, the health boards are being measured around their number of delays as a very high level. It doesn't get into any more detail than that. It will be a topic of conversation through their escalation arrangements, for example, and their performance arrangements with Welsh Government, but they are very much kind of focused on delayed discharges. There will be some kind of monitoring around how they're using some of the money. So in the reports, we've talked about things like RIF monies, and that's obviously, again, a partnership arrangement, understanding the impact of that. But predominantly, the health boards are being measured on delayed discharges. You mentioned about GP signing off. I think you probably mean the kind of the hospital doctors signing off the discharge. And that's where that recommendation we've raised is about that kind of 7-day working, but it's a joint recommendation for the health board and for local authorities, because yes, clearly the health board's got a role to play for 7-day working for their own staff, but also it's about kind of that care provision as well. So that ability to be able to discharge people at home is quite often a challenge if there's no kind of domiciliary care, for example. So it's kind of a joint arrangement in that one, but there isn't any particular performance measures on that aspect of it. So they are quite high level in relation to kind of delayed discharges, or pathway of care delays is the more kind of formal terminology.
Okay, Mike?
Yes, that's okay. Yeah, the lady was correct. It is, as I say, if they've been discharged by the doctor that's been treating them in hospital, I think that's where the issues do arise, where people are unable to be discharged because of that's a sign off from that doctor. And as I say, people also have their families to come home and perhaps go into one of our facilities, but we're held up because we haven't got the appropriate documentation signed off and in place.
There's similar issues for all professions, so it could be that the medicines, for example, that aren't available, or they need sign off by a physio, for example, and that physio is not available over the weekend. So there's similar issues across all professional groups from a health perspective, and that again is kind of part of that recommendation we've made for the health board.
Thank you, Anne. Can I move on, Mike?
Yes, Chair, yes.
Thank you. Julie Davis.
Thank you, Chair. This is a very comprehensive report, so I appreciate you sharing it with us. And it does show how the region compares to other regions in Wales. But my question is, do you intend to perform any comparative?
You've gone silent, Julie.
Apologies.
Okay.
I don't know how far you heard. Is there
Comparative bit.
Oh, right. Is there
Comparative.
any intention to perform comparative studies between us and the other nations of the UK? I appreciate that there are different ways of working, but I would think that the outcomes that we're all striving to achieve would be the same.
There isn't an intention at the moment, just because the arrangements are different, and it also depends on kind of the work programs of the other bodies. But we will try and signpost things like GPX good practice events where we can do. We are linking with colleagues in Audit Scotland who are about to embark on a similar kind of review, looking at delayed discharges from a national perspective. So we'll be able to kind of signpost to those. But it's not kind of part of our formal programme, but we'll do as much as we can within the kind of limitations that we've got from a resource perspective, if that's okay.
Thank you. And I did have a question for Ness, but as she's not here, perhaps I could forward that to you, Chair, and copy it into Jeremy. It was around the arrangements that the Swansea Council can put in place to look at the challenges of staff moving between local authorities and the 7-day working week, which I would imagine could be considered as part of the workforce development plan.
Okay, if you can send your comments through to me and Jeremy, then we can get them off to Ness then. Thank you, Julie.
Thank you.
Where are we now? Councillor Mike Lewis.
Thank you, Chair. Yes, a question for Anne. Am I correct in my understanding that the IT systems of the NHS and the council systems are incompatible at the moment? And is this causing a delay in us finding, as you put it earlier, a step down for patients who are being discharged from hospitals? Thank you.
So the answer to the first part of the question is yes, I think the systems are incompatible at the minute. And that's part of the kind of going forward would be the new solution around connected care. We've not looked at that in detail. You'll probably be more cited at that than we are. But there is an IT system issue that's causing more of a communication barrier. So it's not necessarily delaying people being moved to the right place. It's just making life harder, really, from a professional perspective, that people are having to kind of pick up the phone, which isn't always so easy these days either, because you need someone to answer it at the other end. It's like those communication barriers, where if there are joint integrated systems that all professionals, different organisations can see, it would be a much smoother process.
Okay, Mike. Okay.
Yeah, thanks for that. Yeah, thank you.
On the back of that one, I see in the report reference to an updated integrated discharge strategy, which aims to streamline discharge processes with a unified approach. Is that going to help in any way with the current position?
It should do, because it will help in that the recommendation in relation to training and guidance. So having that updated process that is then communicated to staff will help the staff understanding, and all organisations kind of being on the same page in terms of the process. So it will help in that sense.
Okay. And that's implemented now, Anne, is that?
Yes, I think it is. I think that was led kind of partly through the RPB.
Thank you. I think for me, the key thing as well is the development or the enhancement of the risk exposure to take into account all partners through the regional board. I'm aware that the council does include, as part of their wider ranging safeguarding issues, this particular area of concern. But I take your point at paragraph 108. There's no specific reference, and I think that may be something that NES will be picking up with the development of the risk register that's currently underway. And also we're awaiting the report from Audit Wales on the risk management issues as well. So hopefully that will be picked up pretty quickly by the council. Are there any other, David, and then Gordon?
Thanks, Chair. Thank you, Anne, for the report. Very interesting reading, going through it and everything. I just wanted to pick up a couple of points, really. On page 72, and it says paragraph 75 and 93, it talks about section 33 money, and I'm going back to Councillor Paxton, where he said about joint working during the pandemic. And I think there's a key here. Having been in a post myself about 20 years ago under section 33, there's enormous benefits in pooling that fund and getting the functionality out of it. And obviously it mentions in there about the trusted assessor model locally, which has been developed. But I just wondered, again, picking up on the All Wales perspective, was there any examples of the section 33 money being used for this end and at this particular function? Thank you.
If it's okay with you, Chair, I'll need to go back and just double check that. I don't have that information to hand, because I'll need to just kind of remind myself on all the different regions. We have got references to section 33 in different reports, so we'll be able to kind of draw on that.
Okay, that's fine.
We've also referenced, obviously, the RIF money as well in terms of the Regional Integration Fund, and that's obviously being used for lots of initiatives to kind of support the discharge process, as well as obviously providing support to people out in the community and ideally preventing them being admitted in the first place. But we'll kind of, I'll come back to you on that one if that's okay, Chair.
Okay, yes, please. If you can forward that clarification to Jeremy, and then Jeremy can circulate it to all the members of the Governance and Audit Committee. Yeah.
Okay.
Can I take Councillor Leslie Walton first, please?
Yeah, thank you, Chair. I'm a bit concerned that nobody from our Social Services Department is at this meeting, because I'd like to hear their perspective of this report, and I'm wondering if that's going to happen at some point.
I've just been told that the individuals concerned are on annual leave, which is why they're not here. But I'm sure that we could invite them, Councillor Walton, to come to the next meeting just to give their perspective on the report and actions they're intending to take, if you wish to request that. I'm happy to
think so. I think it's absolutely essential, because basically the whole of this report is based between the relationship of the hospital doing the discharge and what social services packages are available and how they've been arranged. So we need to know what they think that they're doing at the moment, and find out their reaction to the recommendations, and so on and so forth. So yes.
I'm happy to support that. Can I have a show of hands if everyone's happy to support the social services? Then we'll send a request to David House, is it? Yeah. To David House to ask if representation can come from the social services to the next meeting. But that is an excellent suggestion. Thank you, Councillor Walton.
Sorry, Chair, if we've actually got somebody from social services, what about the other side as well, the health? Well, you know what I mean. I don't want to slam you much, but you know, it's supposed to be a partnership at the end of the day. You know, you can't have one without the other, can you?
Yeah, I mean, it's a regional partnership.
I know. It's a difficult one.
I think it's appropriate for us to get a view from David Howes on how he thinks that relationship is formed, and whether it's working as well as it did during the pandemic. Councillor Paxton.
I just say, Chairman, I think I remember it must be about 8 or 10 years ago, we actually did get the health board to come to a scrutiny meeting, but that's the only time I can remember it happening, and in that period of time. So I think we ought to ask, whether we get anybody, I think, is another matter.
I think we need to see what David Howes has got to say to us beforehand, and then we'll have to check with legals as to what the rules are. Gordon.
Yes. Thank you, Anne, for the report. If I can take you to page 94, your graph on Appendix A, it shows that over the last 2 years, the position in Swansea has marginally improved, and the position in East Port Talbot has improved a little bit more. But yet the Welsh position, there's been a significant improvement there. Now, we hear that Betsy Cadwallader does in special measures, so I'm not expecting they would improve much. So can you tell us where the national performance has improved and what lessons we can learn from what's being done elsewhere?
Sorry, can I just clarify which page you're looking at?
Appendix A, it's Exhibit 26, the number of adults waiting for long-term care home accommodation per 100,000 head of population.
It's page 94 of the pack, Anne.
Okay, sorry, I'm not looking at the pack, I'm just looking at my report. So let me just
page 46. Page 46, sir.
Okay.
It's Exhibit 26.
Yeah, so this is in relation to specifically to kind of care homes. So again, some of this I'll need to come back to because it obviously does vary across Wales.
Okay, that's fine, Anne.
Exhibit 26. Yeah, I mean, some of this will be to do with some of the challenges that local authorities have got around care homes closing, for example. But it'll also be to do with the numbers of people going through the process and actually how many people are also being kept in their own homes, etc., with the community care packages. So that, again, there'll be a number of factors. But again, I can come back to you on this in terms of whether there's any kind of pockets of good practice in relation to this.
Okay, that's perfectly fine. David, another?
Not particularly a question for you, Anne, but for us as a group, really, because it mentions in the response between page 95 and 102 about a timeline of March 2026, and I presume that's a timeline for the Regional Partnership Board to obviously monitor progress and report back. And for us, Chair, it's just having, I'm picking up Councillor Jones's point, having some feedback from that Regional Partnership Board from both perspectives, really, both from health and social care, as it's a partnership board, and how things are progressing up to that, obviously, first timeline in March 2026. Thank you.
Thank you, David. I mean, I'd expect to see these recommendations included in the Audit Wales tracker paper that we get, and there's one in the pack today. And we can see the level of information, and if that's not sufficient, then we can request whatever it is we think we need.
Yeah, thanks for that. Thank you.
Okay. Anne?
So if you mind, can I just come back to you on this? So just to echo your point, we'd expect to see those recommendations on the audit trackers for the individual bodies. So yes, we're using the RPB mechanism because this is a regional report and it's using that mechanism that's already in place where the partners are around the table. What I can double check for you, because I know in the other regions, the report has gone to the RPB, so there's been oversight there. So going back to your earlier point around having health boards kind of representation at this meeting, it may be that you want to do that through the RPB to start off with, because obviously the partners are on the table and you'll get that collective response to the report. this report has been through the Health Board Audit Committee, so obviously they've also provided scrutiny from the Health Board perspective. But as you said at the start, this should be on the audit trackers, so we'll be able to kind of see progress with those through the respective audit trackers as well.
Yeah. Okay, that's, if there are no further questions, no further hands up either. Can I thank you, Anne, for the report? I mean, it's a very detailed report, and very important that we keep this on the radar, because this is a huge pressure for both health and local authorities. And if we can make any improvement to deliver these recommendations, that's got to be for the great, really. Okay, then coming back to Audit Wales report number 6, I believe.
Thank you, Chair. I'll take that if that's okay.
Okay, thank you, Gillian.
This is our audit plan for 2025. Members are probably familiar with the format of it. It's fairly similar to previous years. So it just sets out how we'll undertake our audit in terms of work we plan to do to discharge our statutory responsibilities, and informs you when it will be undertaken, how much it will cost, and who will undertake the work. Also just provides a reminder of the Auditor General's 2 primary duties, which are for auditing the financial statements and undertaking performance audit work. So in terms of our financial audit work, as you know, the Auditor General is required to audit your financial statements and to give an opinion on the truth and fairness of their accounts, their proper preparation in accordance with accounting and legal requirements. It also includes responding to any questions that may come from local electors in relation to those accounts, and also our responsibilities to audit a number of grant claims. External audit can never give absolute assurance that the accounts are accurate, so we use the industry standard concept of materiality, being those misstatements that might result in the reader of the accounts being misled. So the materiality levels we're working to are set out on page 8 of our report, which is page 15 in your pack, and is 11.69 million, which is based on 1% of your gross expenditure. But there are some areas of the accounts where we set a lower level of materiality because we judge them to be maybe more interest to users of the accounts. So things like senior officer remuneration, we set a materiality level of £1,000, and also related party disclosures for individuals where we've set the limit of £10,000. So our audit approach then is based upon our assessment of the risks of material misstatement, and we've identified one significant risk, which is the management override of controls, which is viewed as a significant risk in all audited bodies in accordance with auditing standards. We've also identified 6 other risks or areas of focus, which are set out starting on page 9 or page 16 of your pack, which are the valuation of pension fund net liability, as this is a material estimate which involves a lot of assumptions and estimates to calculate. The valuation of land and buildings, again, another material amount with judgments involved in valuing them. Remuneration disclosures, as this is of high interest and low value errors could result in a material misstatement. And we have the implementation of IFRS 16 in respect of leases. This is the first year the Council have been required to adopt IFRS 16, which significantly changes the accounting treatment and disclosures for leased assets. As it's a new standard, obviously the risk is slightly higher than it would otherwise be. We've also got then the impact of the Renting Homes Act and the electrical safety certificates and related party disclosures. The timetable of when we plan to carry out your audit is shown on page 14, page 21 of your pack. We have undertaken some planning work and done a fair bit of interim testing, but our planned start on the final audit is again subject to discussion depending on when the final accounts are presented for audit. And in terms of performance audit work, the Auditor General has to satisfy himself that the Council has made proper arrangements for securing economy, efficiency and effectiveness in its use of resources and is acting in accordance with the Sustainable Development Principle. We do this through a programme of performance audit work, which we undertake each year based on the assessment of the risks of the Council and the wider local government sector in Wales. Details of our planned audit performance audit work are shown on page 17 and will cover a thematic review of staffing, resources and pressures in local government, and then local audit work on counter-fraud arrangements and housing and homelessness services. And the estimated fee for your audit is £437,749. That's shown on page 19. And that reflects a fee rate increase of 1.7% in line with our published fee scheme, and also a 3% reduction in our financial audit fee, which has arisen from efficiencies in implementing the revised audit approach that we adopted in 22-23. And then on page 23, we set out for your information our audit quality arrangements, and page 24 then draws attention to where you can access our publications and any other information that you might find useful. And that's all I intended to say, Chair, but if anyone's got any questions, I'm happy to take them.
Thank you, Gillian. Are there any questions for Gillian? Not seen any in the room. No hands up. Thank you for this, Gillian. I've just got one question. It's on page 17 of your report, page 24 of the pack, where the review of housing and homelessness services. Will your work include coverage of the impact on this local authority for homelessness from other local authorities? So I'm aware that individuals move from one area to another, and I'm wondering if your work will look at that, because I understand there's some pressure on Swansea City Council by that cross boundary of movement.
Just hand over to Gareth. That's more his expertise than me.
Gareth?
Thank you, Gillian. Thank you, Chair, for the question. We haven't as yet scoped up finally the work in that area, so that is obviously part of the work that we will do to establish the topic area, and you've raised an important issue there that we will take into consideration as we move forward with that scoping of that audit and concluding the scope and the questions that we'll be asking. So we will take that up with officers in due course.
Okay, thank you. I'd appreciate that if you did. And good to see the 3% reduction on the finance. And obviously, you know, we'd love to see a lot more percentage reductions through efficiency savings. So, but thank you for that report. And if there are no other questions, then can I thank you, Gareth, Gillian, and Anne, for your attendance today. It is lovely to see you all, and maybe one day you can pop into the Guildhall and come and see us in person. But thank you so much for joining us today. Okay, if we can move on to section A of the agenda, and these are reports for our discussion. And the first agenda item is at agenda item 9, and that is the appointment of our representative on the strategic governance group. Councillor Leslie Walton has done a wonderful job over the last number of years in being our representative on this report, which looks at the publication of the annual governance statement and other areas of the business. Obviously, I'm not quite sure if Councillor Leslie Walton wants to say, but let's take a vote for a representative, or nominations, please, for a representative of that group. Councillor Mike White?
Yes, Chair, I would just like to endorse Leslie. Continues, as you said, she's done a first-class job.
Second it? Someone to second it?
Yeah, Mike Lewis.
Yeah, Councillor Mike Lewis. Are there any other nominations? No. Councillor Leslie Walton, are you happy to carry on for us with the recognition of the really good job that you've been doing all along?
Yeah, I suppose I'd better now, hadn't I?
Well deserved, yeah. What about a reserve? Do we need a reserve? We did on the last vote. Do we need a reserve, Leslie?
Well, there is always the possibility that I might miss a meeting that I can't avoid. So I'd nominate Mike White to carry on.
Okay, can we have a second for that, please? Councillor Mike White to carry on. Yeah, got a second with Paxton. Okay, Mike?
Yes, that's fine, Chair.
Okay. So thank you, though, Leslie, for all the work you've done in that area over the last 4 years, and I'm sure we'll continue to see more good work as the year progresses. The next item on the agenda is agenda item 10, and I'd like to welcome Nick, who's representing Simon Cockings, the Chief Auditor, who's in sunny Portugal, I believe, at the moment. So welcome, Nick. As I say, the report is for discussion. Although it says for information on the report, it's for discussion. If I can welcome Nick to take us through the report. But before you start, can I just highlight paragraph 2.7, considering all the pressures that have been on the internal audit team over the last 12 months, the outcome that's depicted in that paragraph has been excellent. So I wanted to start that off, Nick, because it was looking very stressful for Simon and yourself mid-year, and to recover to that extent, it's quite an achievement. So well done. If I could let you carry on.
Thank you, Chair, for that. And yeah, I'll touch a little bit again on that in the report, but yes, much appreciated. Thank you. So good afternoon, everybody. Today I'm presenting our internal audit monitoring report for quarter 4 for 24-25, which is agenda item number 10 in the reports pack, and it covers pages 113 to 140. So this report shows the audits finalised and any other work undertaken by the team during the period the 1st of January to the 31st of March 25. And it's recommended that the contents of this report is noted and discussed by the committee. And as usual, happy to answer any questions or queries you have at the end. So if members can turn to the top of page 115, section 2, paragraph 2.1. So a total of 24 audits were finalised during the quarter. The audits are listed in Appendix 1, which also show the level of assurance awarded and the number of recommendations made and agreed. Appendix 2 then provides a summary of the scope of the reviews finalised during the period. 2.2 is a table below which gives an analysis of the assurance levels. So for the 24 that were issued, you could see 12 had a high assurance, 10 a substantial assurance, and 2 a moderate assurance. Moving on to 2.3, a total of 158 audit recommendations were made, and it's nice to see that management agreed to implement all of those recommendations. And as committee are aware, all recommendations are classified as either high risk, medium risk, low risk, or good practice. And again, the table below shows the recommendations and the split then really of the 158 into those categories. Moving on to 2.7. So yeah, some excellent news here, Chair, and the committee to report is, as at the 31st of March, 87 audit activities, which is 73% of the plan, had been completed. With 4 activities, another 3% substantially complete as draft. So as a result, 91 audit activities had been completed to at least draft report stage, which was 76%. Furthermore to that, an additional 14 activities were in progress at the end of the quarter, which is another 12%. And as a result, that's 88% of the plan that had either been finalised or were in progress at the end of the year. So congratulations to the team there. 2.8, so I mentioned earlier that 2 reports with a moderate assurance level was issued in the quarter. They relate to the Branwyn Hall and Helagos Finance, Admin and Stores. So at the time of writing this report, the issues identified in these audits were still being discussed by CNT and the relevant departmental managers. So discussions are yet to be concluded. So the full update reports from the service areas will be in the reports pack in the July Governance and Audit Committee meeting. Section 3, 3.1, the team also completed some other work during the quarter. The first being the Chief Cashier's interest account, which we reconciled. Secondly, it should be 3.2. I think it's down as 1.2 as a typo, but we touched on it earlier. But the team, we have had some new staff, so we've put a lot of training time in for the new members to settle them in with trainings and inductions and mentoring, and it's nice to say that they've settled in smoothly into their new roles. Section 4, follow-ups of audits with a moderate assurance level in the quarter. So we can see that one was followed up, and that was the DBS service. We undertook a second follow-up, and we found that there were still some issues there that hadn't been, some recommendations that hadn't been fully implemented. So I discussed this with Simon, the Chief Auditor, and rather than go and do a third follow-up, we've added a full audit to the DBS service in the 25-26 plan. 5.2, so the follow-up results with audits with a high and substantial assurance level. You can see below in the table. So there were 119 recommendations in total, and we had confirmation from the managers that all of them had been implemented. So moving down to Appendix 1 is the list of the 24 audits finalised, which you can see there. Appendix 2 is the summary of the scope of those audits that were finalised. Appendix 3 shows the annual plan as at the 31st of March 25. Now finally, Appendix 4 shows the higher substantial audits that we follow up. There's 14 audits in total with those 119 recommendations that have been implemented. Thank you, Chair, and happy to take any questions.
Thank you, Nick. Before I open up for questions, I've mentioned the positive outcome, but I'd also like the members to be aware that I discussed the DBS report follow-up work with Nick yesterday, because I was somewhat couldn't understand why from 2023 to 25, because the second follow-up was done in March 25, why these high risk and medium risk actions weren't taken. And I've had confirmation that the reports were received, they were agreed, and we have previously been told that the moderate reports would go to CMT and further up the escalation chain. So I think we need to have confirmation from, I think this comes under Ness's remit. So if Ness can confirm back to us that prior to a full review being done with the DBS service in 25-26, that action has to have been completed. I see no point in the auditors going in for the third time with no further action being taken. So if we could ask Ness to come back to us with confirmation that all the audit recommendations have now been completed and there are no risk exposures for the council regarding the DBS situation.
Yeah, thank you, Chair. I agree that there's no point us going in if the recommendations haven't been fully implemented. So happy to wait for that confirmation.
Okay, if I can open up to questions then. Anyone in the room got questions? David?
Afternoon, Nick. Just a
Hi,
couple
David.
of questions. Hi, just a couple of questions really in regard to paragraph 3, page 117, paragraph 3. I think it should be 3.2, not 1.2. The sub paragraph there, and linking it to appendix 3 on page 138 in regard to the deferred items list you've got there, which I think account for so 50% is accountable through sickness and absence. I just wondered now with the new recruits and things are bedded in now, that we'll see a big reduction in that deferred list as we go forward in 25, 26. Thank you.
Yeah, thanks, David. And yeah, there's all the deferred audits are deferred onto the 25, 26 plan. So they're all in there for this year. Yeah, with the sickness and vacancies, just to give you an update really on the staff, I did touch on it just now, but in fairness, the new members of the team have settled in well. When they were appointed back in December, we put a comprehensive training package, of procedure notes and mentoring and the further option to shadow our more experienced auditors during their reviews. So this has worked really well, and they are now conducting their own audits, which are overseen by senior auditors, which is the same for every audit that we undertake. So good news on that front, and we expect, the team's at full capacity at the minute. So we expect that the deferred audits with the sickness and vacancies description against them, hopefully, will all be undertaken in the next financial year.
Thanks, Nick. Thanks for that.
Okay. Any questions from remote? Julie.
Thank you, Chair, and thank you, Nick, for attending today. In terms of Appendix 2, you did a review on capital leasing. So I was wondering what assurance you can give to the committee in terms of the IFRS, because that was introduced in 1st of April 2024. And I was wondering if you could give us assurance that any new or revised processes have now been embedded.
Yeah, thank you, Julie. Yeah, we undertook that audit and it actually came up with a high assurance. So I'd have to go back and look at the actual leases that we did test. I'm quietly confident that we comply with the international standard, but until I really get the devil behind the detail, I can't give you that full assurance. But we've done the audit, we've undertook it, it came up with a high assurance, so I'm quietly confident.
Thank you, I'd appreciate that. And a second question in terms of home to school transport. It's noted that there was no evidence of approval by procurement, nor inclusion in the council's contract register for a number of the items tested. And I was wondering what assurance you can provide in terms of the council's risk exposure with these omissions.
Yeah, it's something that we looked at the time, and yeah, basically in the case of the 10 contracts we selected for testing, 5 of them we couldn't gain evidence that they'd been approved by the procurement section, and they weren't detailed in the contract register. So that's not to say the contracts weren't in place. However, as standard, we do check those being procured through the correct channels. So when we received the action plan from the manager, they stated that they were going to check and liaise with procurement. So we will review this again when we undertake the follow-up exercise to see if the manager has, got hold of those contracts and hopefully, they are in place.
Okay, thank you.
Yeah.
Perhaps you could keep the committee updated on anything that you find. Thank you very much.
That would be included in the follow-up, though, Nick, wouldn't
It
it?
will, yeah.
Okay.
Chair, can I just thanks, Chair. Nick, just picking up on Julie's point around the transport one, the home to school transport. Obviously, there's an issue there on that right-hand column about lack of contract. And I just wondered, I don't expect you to answer it, maybe it's more of a corporate one, but is there a risk impact on insurance and liabilities, considering obviously children's transport and home to school, etc.? I just wondered what the response would be legally from that perspective with the lack of contract. Thank you.
Thanks, David. If it does prove that there weren't contracts in place, then of course there is that the risk on insurance and any sort of liabilities. But, you know, until we establish that, you know, we're waiting for the manager to come back now once he's spoken to the procurement team, you know, to make sure the contracts firstly are in place. And if they are, then fine. But, you know, we need to make sure that they're on the contracts register and procurement have been involved. So, yeah, we will certainly chase that up. And as the chair says, and we discussed yesterday, that'll come through now when we do the follow-up.
Thanks, Nick, and just like everybody else, thanks for your work along with Simon. Thank you.
Thank you.
Nick, just to be clear on that one, at the time of the fieldwork, they were unable to present you with a contract, but they're now gone away to find those contracts they believe are in place. So potentially there may not be any risk. It's just that at the time of fieldwork, they couldn't find them.
That's correct.
But that's fine. So if they find them by the follow-up review, then those risks are not present. Yeah. Okay, just wanted to clarify that. That's all, Nick.
Yeah.
Gordon.
Thanks, Chair. Thank you.
Yes, thank you, Chair. I note in your review of schools opting out of central catering, that's been deferred. Just some clarification. With the local management of schools now, does that mean that the governing body are able to set their own standards for procurement? And if they're opting out of central catering, does that mean that the staff involved are then employees of the governing body rather than employees of the council?
Thanks, Gordon. I'd have to check. Obviously, we haven't undertaken the review yet. I don't think there's many schools that have opted out, but it's something that we will be looking at when we undertake the review. We need to scope it out as well. It's a new audit that was on the plan for last year, which we've had to defer. So it is on the plan for one of my auditors for Q2. So I'm hoping we can get that started. And, you know, we'll get the results once the review is underway.
Thank you, Nick, for that. And if you can bear that question that Gordon's raised in mind, so that, you know, if it's asked for when that report comes back, then you're able to respond.
Okay.
Councillor Mike White. Oh, sorry, I think Leslie was first. Councillor Leslie Walton. Sorry, Mike.
Yeah. Just to go back to the point you made before with people ask questions, this issue about the 2 audit reports, moderate, I am a bit concerned that they haven't managed to come to this meeting, and not just a case of because there might be failings that could be detrimental to the council, but also the sooner we know about it, the sooner we can perhaps provide help and support to those 2 issues. So just register my concern and hope that in future, when we normally get a moderate reading, we will have at that meeting the representation or at least a report provided. Thank you.
Thank you, Councillor Walton. Just to be for information, I have been in contact with Ness, but she's away at the moment. Because I wanted to raise that with her before the meeting today, but we've asked Ness to come back to us on that through Jeremy. But you're quite right, Councillor Walton.
And yeah, thanks, Councillor Walton. I do agree as well. I think that you know, when we present our reports, quarterly reports, if there are any moderate assurance ratings on there, it would be beneficial for the you know, the heads of service or the service managers to be in attendance in that committee meeting. But I think on this occasion there's still discussions going on behind the scenes, so unfortunately that's been deferred really until next month.
Councillor Mike White.
Yeah, just to follow up things, I think it was David O'Gordon raised it regarding school catering. As you know, following the issues that we were getting back about lots of schools not understanding the procurement process. I know all head teachers have now been trained in regards to procurement and how the process works. That was the recommendation from the procurement scrutiny panel, which we carried out for about 12 months. And also staff would probably would go over under the 2P regs anyway. into the roles within the School of Catering.
Thank you.
Okay. Thanks, Mike.
Okay, if there's no further questions, then can I thank you, Nick, once again for taking time out to attend the Governance and Audit Committee today, and appreciation to the team as well.
Okay. Thank you, Chair.
If we could move on, the next item on the agenda is the draft annual governance statement 24-25. Is Richard Rowlands present to
Yes,
take
Chair.
us through this?
Yes, Chair, I'm here. Yes.
Can I just ask if Councillor Leslie Walton would have any comments on it? Please join in, Councillor Walton, when Richard's presenting. Okay, Richard.
Thank you, Chair. Apologies, first of all, I am experiencing some internet connection problems, so my camera is off to try and help with that, so apologies for that. The report itself starts on page 141. It introduces the draft annual governance statement for 2024-2025. The statement is informed by a wide range of internal and external sources of evidence, and the draft is overseen in its development by the Strategic Governance Group, which is chaired by the Director of Corporate Services and attended by the Chief Executive, the Section 151 Officer, the Monitoring Officer, Councillor Leslie Walton as a representative of the Governance and Audit Committee, and the Chief Internal Auditor as an observer. You can see the statement itself attached at Appendix A, which is starting on page 145. And I'll just quickly take the committee through the key sections. But as a starting point, the framework for good governance in the public sector, which is published by SIPFA and Solace, is structured around 7 principles, which you can see set out in paragraph 3.3 of the statement itself, which you can see starting on page 146. And that explains how the council complies with each of these principles. And if you look on the left-hand margin page numbers and look for pages 148 to 154, this is where we have the 7 principles of good governance and how the council meets each one, and it's detailed in that part of the document. And then on page 155, there's a diagram which illustrates the various internal and external sources of assurance which support compliance with those principles. The main body of the statement itself, you can see in pages 156 to 175, and that provides detailed descriptions of the different assurance mechanisms. So that includes the internal sources of assurance, such as the work of the monitoring officer, the Section 151 officer, and the Chief Internal Auditor, and that runs to page 167, and it also includes the work of the Governance and Audit Committee as well, which is covered in more detail on pages 165 and 166. In this year's statement, we have a new section, which you can see starting in paragraph 10 on page 166, and that's around the conformance with the Code of Practice for the Governance of Internal Audit in Local Government. And that statement there confirms that Swansea Council's internal audit arrangements conform with national best practice as outlined in the SIPFA Code, and to explain how this compliance has been assessed and maintained. So the internal assessment there confirmed that both the internal audit team and Swansea Council conform with the code. Some recommendations were made to enhance compliance, which will be addressed then in the coming year. The external source of assurance, including the reports from Audit Wales, from Ken Spectorate Wales, and from Estin. There's a brief summary there on pages 167, 168, but there's more detail in Appendix A of the statement, which you can see starting on page 180. The role of Cabinet, of Council, and the different committees, including scrutiny, in terms of them providing further assurance, that's outlined on pages 168 to 175, and that covers a range of evidence, including performance, the management of risk, as well as service transformation. The table on pages 176, 177 provides a status update on the significant governance issues identified in the previous year's statement, including the progress that was made. And then finally, the significant governance issue identified for action in 2025-2026 is listed in the table on page 177 and 178, with actions planned to address this issue over the coming year. Thank you, Chair.
Thank you. Leslie, do you want to comment on?
Yeah, just to highlight a couple of issues, typos. I know, Chair, you pointed out that there's a paragraph that still refers to COVID. I think the paragraph is still relevant, but I didn't spot until you pointed it out that the actual year is wrong. But I've passed that on to Richard, so that's a minor point. There's another couple of typos that I've raised. I know you also raised the issue of Simon's report, and I don't know quite where to go with this as he's away at the moment, whether Nick can look at that and make sure that it is the right one. It could be that for some reason this hasn't been amended correctly. I don't know. So Nick, would you be able to help on that?
Nick, this is the
table
box that I shared with you yesterday.
Yeah, thanks both. I did a little bit more digging this morning, and the figures in the table are correct. Now, what they are, it's the actual number of audit reports finalised, rather than in the Q4 report was the actual number of activities finalised in the year. So when we issue a report, we issue an assurance level, but there's other activities that we do that could be in the form of a briefing note or a memo, or even just other exercises that we do, i.e. follow-ups and so on, where we wouldn't issue a formal report and assurance level. So the figures are correct. They are the actual number of reports rather than activities that we've completed, if that makes sense.
Yes, it does, but you need to put a footnote on one or other of the documents because people are not going to understand that.
And match the two up.
And the figures are significantly apart.
Yeah, we can do that. I'll speak to Simon when he's back, and maybe we'll just clarify that underneath the table to say it's the reports issued and not the activities that have been finalised then. Yeah, happy to do that, Chair.
Thank you, Councillor Walton. The other thing I raised was the significant issues at the back of that report, because there are other significant issues which appear in performance reports that I would have expected to see, Richard. I don't know, Councillor Walton, if you've shared those with Richard for consideration.
Yes, I pass that on.
Okay. So Richard, can I clarify, will we see another version of the draft before it becomes a final document?
Yes, Chair, if there's opportunity in another meeting, then you will definitely be able to see another draft. And if not, then we can circulate that to the committee by email. Yes, that's no problem.
Oh, that's helpful. It's lovely. Are there any questions or any other questions on the report? Can I thank you, Richard, and welcome you back as well? Nice to hear your voice.
Thank you, Chair.
And also thank you to Councillor Walton for the work she's done with that. If we can move on then, if there are no further comments, to agenda item 12. And that's the annual review of performance. I'm not quite sure who's taking.
That's me again, Chair.
Richard again, is that?
That's right, Chair.
You're back with the flow then, Richard.
Yes, that's right. Thank you, Chair. So this report, you can see it starting on page 183. It introduces the annual review performance for 2024-2025, and this is the Council's statutory self-assessment and wellbeing report. So it's a requirement of the Local Government Elections Act and also the Wellbeing of Future Generations Act as well. So in that, it seeks to evaluate how effectively the Council has exercised its functions, how well it's used its resources, and what it's done in terms of delivering its 6 wellbeing objectives during that financial year. So as described in paragraph 6, it's based on a wide range of evidence. So the performance data, the risk and audit findings, stakeholder feedback, internal, external reviews, lots of evidence is reviewed in terms of pulling this together. Then to ensure that there is consistency and transparency, the council has used a common framework to assess performance across those 3 dimensions. And as outlined in paragraph 9, each area was evaluated using a 4-point scale. So strong, good, mixed, or priority for improvement. And that rating was then reviewed and overseen by the strategic governance group. Overall, paragraph 16 states that the council's performance is rated as good. So that's considering the strengths, the risks, and the areas for improvement, which are summarised in paragraphs 18 to 20. Each of the 6 wellbeing objectives were also assessed as good, which is summarised in paragraphs 22 to 27. Regarding the application of the Sustainable Development Principle, the Council demonstrated strong alignment with the 5 ways of working, and that's set out in paragraph 28. The review identified several cross-cutting priorities for improvement, and those are described in paragraph 29. Paragraph 31 details the stakeholders' input that was used for the review, and then in paragraphs 33 to 40, that summarises the risks and issues that were cited in the review and the mitigation strategies in place, which are actively monitored through the corporate risk register and through the internal governance frameworks. So the overall conclusion is that the review seeks to present a balanced and evidence-based assessment of the council's performance, and in doing so it seeks to highlight areas of strength while also setting out clear priorities for improvement. Thank you, Chair.
Thank you, Richard. Any questions from members, please? Not seen any hands there. Yeah.
Hi, Richard. Just in regard to page 199, it talks about the consultation and engagement element. And if you go over to page 200, it obviously starts off with engagement with citizens and residents and everything, which is fine. But then in the middle of sort of the 4 paragraphs on page 200, we have then staff views, business community and partnerships. And I just wondered, does that actually need to be in there? Because it tends to detract and highlight the actual view of citizens and residents. Thank you.
Thank you. Yes, I mean, I think all of the stakeholders are important in terms of trying to assess the performance of the council. The residents' feedback, that's vitally important because we're delivering services to the people of Swansea. They're showing that there's mixed satisfaction with council services, so that's important. But also in terms of that national review that was undertaken amongst the participating councils, it showed that Swansea had the highest trust score there. But then when we looked at what was coming back from staff, there was a feeling that within the council itself there were supportive teams and there was some positive views around flexible working, but the need for better recognition and leadership visibility, and the chief executive is addressing that through his staff engagement issues. And the work that we do around transforming the economy, we have a vital relationship there with the local business community. So positive relationships and a shared commitment to improvement, which has come through the consultation, I think is important. So I think you're right that the resident feedback is vital, but we do have to consider as well what the other stakeholders are telling us.
Okay, thank you, Richard. Thank you.
Any other questions? Can I just point out on page 192, Richard, the oversight by council committees. The middle bullet point there, it talks about the governance and audit committee. Can you just double check against our terms of reference? Because I don't think that word in oversight of governance, risk and financial management is correct alongside what's in our terms of reference. So if I can ask if you can check that for me, please.
Certainly, Chair.
I don't think got anything else on that one. And if there are no other questions, then sorry, Gordon.
You said that the schools in Swansea already have the highest reserves in Wales, and yet they increased last year. Is there something wrong in the budget planning process when that happens?
I'm probably not the best person to answer that one. I think I'll probably refer that to the education department to answer that, I think.
Yeah, can we take that away and get the education department to question that one? If I can just reflect on the work of the scrutiny panel with regards to performance, Councillor Chris Hawley is very involved in performance down to the detail. We're just looking for assurance that, because it's within our terms of reference, that we are seeing the performance reports and it's being reviewed by the relevant committees, which this report is describing. So it's just a comment to make, really. If there are no further questions, can we? There's a couple of recommendations I'm being pointed to. We've been asked to provide assurance that it's fair and balanced assessment and to identify best practice. So are we happy to take that? It's in the middle of the first covering page. Are you happy to take that? Yeah. Hands up for those on screen. Okay.
Yeah.
Thank you for the prompt, Jamie. And if we can move on then to agenda item 13, Richard again.
Yes, that's me again, Chair. So yes, this report, it starts on page 233. It provides an overview of the Council's strategic risks and issues as of 31st of March. So it covers the fourth quarter of 2024-2025. Paragraph 4 describes how risks and issues are identified, assessed and managed to support the delivery of corporate objectives. Paragraph 9 provides a summary of the status of risks and issues as at the end of quarter 4. So there were 103 total entries on the register, 95 risks and 8 issues. Of the 95 risks, 18 were strategic risks, and of the 8 issues in the register, 7 were strategic issues. Paragraph 12 then summarises the strategic risks. So of the 18 strategic risks, 7 were red, 11 were amber and none were green. All of these strategic risks were reviewed during quarter 4. The risk scores remained stable from quarter 3 with one exception, which was the development of a new waste strategy, which saw its residual risk score to increase from 6 to 12. So it moved from amber to red, and that was down to delays affecting the timeliness of decision making. Also during quarter 4, target risk scores were introduced for all risks, and these will define the desired residual risk level and will help focus mitigation efforts going forward. Paragraph 15 summarises the strategic issues. Of the 7 strategic issues, 3 were red, 4 were amber, none were green. All of the strategic issues were reviewed during quarter 4. One issue, connecting care, improved from red to amber due to progress in addressing the challenges. One new strategic issue was added, which was around occupational health waiting times, and that was escalated from operational level due to its wider impact. And one issue was closed, which was around the CTU fleet management, because that was resolved and returned then to operational management. Thank you, Chair.
Richard, the last time we received this report, Ness confirmed that we were now using the in-phase system.
Yes.
Is that fully rolled out now and operational?
It's in the process of being rolled out. We're going through a phased process in terms of doing that. We're also going through snagging issues at the moment as well. But we're making good progress on it and we continue to develop it. This quarter, we introduced the target scores. And then for the next quarter, we're looking at a measurement around effectiveness, and we're also looking to continue our work to improve the risk controls as well.
Okay, so what's the target date for full implementation and embedding?
I'll have to come back to you with the exact date, Chair. I've been off for a while, so I'm still catching up on some of the things, so I'll come back to you on that.
Okay, I've got a couple of queries, and I think it may be appropriate if I email the queries to you and Ness, rather than go into the detail at the meeting here. Are you content with that?
Yes, that's fine from my perspective, Chair.
Okay. Are there any queries from members, though, for the meeting today? David?
Hi, Richard. Just on
Hi there.
Appendix A, the page 39 and page 40, it talks about accommodation and temporary accommodation. I know the chair brought up earlier about homelessness and the impact of that. But in the description, do you feel that we should be including asylum seekers and immigration issues in these two columns? Thanks.
That's probably something for the service concerned, I think, but we can definitely take that back to them and see what their view is on that.
Thanks, Richard. Thank you.
Thank you.
Julie Davis?
Thank you, Chair. Thank you, Richard. I was going to ask you when the effectiveness column was going to be in operation, so you've answered that, so thank you. Could you explain how effectiveness is going to be assessed by the individual services?
That's something that we're looking at now at the moment, Julie. I don't have an answer for you at the moment. As I said, I've been off for a while. A lot of the development has occurred while I've been away, so I'm still catching up with some of this. But I'll get an answer back to you on that.
Thank you.
Okay, and I will share the queries I've got with members as well on the content of the report. But there are a few, so I wouldn't want to take up too much time at this meeting. But it's around the detail within the report, not questioning the risk, but the detail and the controls that are mitigating some of those risks. If there are no further questions, then can we move on to part B of the agenda? And bearing in mind, at part B, all these reports are for information. We don't expect to have answers to any of our questions, but if there are questions that members have, please ask them, and we can get the responsible officers to come back with the answers for us. So if we take the Successful and Sustainable Swansea Corporate Transformation Plan report first, is there anything within that report that members would wish to ask a question? Any hands up on the screens? No. I'm not seeing any hands up. There's no hands up in the room either. The only question I had is if any of the members knew where this report had been before coming here. The Cabinet has been to Cabinet, okay. Okay, so it's for information, so there are no comments on that one. Agenda item 15, Audit Wales Recommendation Tracker. This is clearly an important document and one that I know Audit Wales colleagues have welcomed, that we keep in track on progress being made by the Council on the recommendations that Audit Wales have made to enhance control and processes. So I don't know whether anyone's got comments on that. You can see some of the recommendations have been closed, so it suggests there's improvement taking place as we speak. And obviously there are some areas where recommendations are in progress, but each of those reports and recommendations are being received by individual officers within the Council and also within committees and scrutiny committees within the Council as well. But we need to keep an eye on that to make sure that time lag is not extending beyond the time that was originally agreed. So if we can move on to the next report, which is the Governance and Audit Committee tracker report. This is our reports to make sure that we are receiving back what we've asked for. There's only one comment I've got on this, Jeremy, is minute reference 71 for the 22nd of January. I've not stopped the directors coming to the Governance and Audit Committee. It's under review and pending the outcome of the Audit Wales report on risk. Because I would like to continue to see directors come in, but with a different format of information. But what I'm waiting, I've agreed with Ness to wait until we receive that audit. So if you can keep that open, please. The work plan is there, and I know Jeremy's going to populate the training section of the work plan. Okay, so if we can put some pressure on those that Jeremy's waiting to respond to his requests for the dates that they can provide that training. I know one is the internal audit training and understanding the methodologies behind the opinions, etc. One is on performance, one is on risk, I believe. So there are a couple of training sessions being planned, but we need to get that populated. So if you can request the officers cooperate with you, Jeremy, that would be helpful. And we now have an item which is an exclusion to the public. So for those that are not members of this Governance and Audit Committee, if you could please withdraw or cancel out of the meeting and stop the recording accordingly.
Happy to.
Are you happy to move this? Yeah. Yeah.
Okay, thank you, Chair. I'll stop the recording now.